With the increase in the opioid epidemic, that affects women, which ultimately affects babies.
Babies born addicted to drugs. Every 24 minutes, a baby nationwide diagnosed with neonatal abstinence syndrome. That's according to the Centers for Disease Control and Prevention. According to data from 2020, that's nearly 60 newborns a day, about 6 per every 1,000 newborns in the hospital across the U.S. In Tennessee, that rate is a little higher.
As our Brittany Tarwater and executive investigative producer Emily Akiyama found out, the solutions to push the numbers down aren't easy.
Within, that first 24-hour period, we start to see they may be sneezing, becoming more jittery, unconsolable.
NAS, or Neonatal Abstinence Syndrome. The State Department of Health calls it a significant public health threat.
From our most recent data, we saw that nearly 800 cases of neonatal abstinence syndrome were reported from recent births. Most of the time, they're associated with opioid misuse in the mother while she was pregnant.
And it's even worse in the eastern part of our state.
If you're in a rural community in East Tennessee, the dollars just aren't there. Along with this opioid epidemic, it goes right alongside the poverty that we're seeing in our communities.
Dr. Lovey Stallworth is a physician at Servolution Health Services. The clinic sits in Claiborne County, which is in the East region for the state's NAS data. That region had the third highest rate in 2022 at 20.7 per 1,000 live births, more than double the state rate of 9.8 per 1,000 live births. Knox County is closer to the state average, with a rate of 12.4. A number Ellie Peebles is very familiar with. She's the prevention coordinator at Metro Drug Coalition in Knoxville.
Here in East Tennessee, we see the highest rates of neonatal abstinence syndrome in our births. That means that we need to be setting the standard for this care that I believe every place should have, but especially here in East Tennessee, we need it.
But getting care can be hard to get for some moms. Stallworth says she sees moms coming to the hospital in active labor who haven't had any prenatal care.
They're delivering babies that are born premature. They're delivering babies that are small for gestational age.
State data shows 53% of women who gave birth to an infant with NAS received inadequate prenatal care, compared to 20% of all women with live-born infants. Stallworth says there are many reasons why a mom-to-be does not seek care.
Because of their social issues, the stigma of drug use, the fear of their baby being taken away, not being able to get to a provider.
While the state rate of NAS is higher than the national average, the numbers have been shifting. 3 regions of the state had lower rates in 2022 compared to 2021, including Sullivan, East, and Knox. The rates did rise in 4 regions: Upper Cumberland, Southeast Davidson, and Mid-Cumberland.
The awareness is better. We're willing to talk about it now. Still working on the stigma aspect. Still working on the access to care.
And a baby's birth is just the beginning.
Tomorrow at 6 o'clock, we're taking a look at the long-term effects of NAS and how some here in East Tennessee are working to give kids the best possible outcome.